Hi guys, this video is going to be my 16-week pregnancy update. I can't believe I'm doing pregnancy updates again. It's just mental and amazing, and I'm so glad I'm doing them much sooner this time round. Last time I started my pregnancy updates at 24 weeks, but I'm really glad that I'm getting to document it earlier this time. It's really nice to have that. And yes, so if you missed my previous videos, I have a first trimester update, which is how I was feeling during the first trimester from about 3 weeks when we found out to 12 weeks. And I'm so sorry I missed my 13 and 14 week updates, but they were kind of more of the same, just getting slightly better in terms of morning sickness, but I'll get into it in a little bit. So yeah, for week 15, which is the week that just passed, I'm 16 weeks and 1 day today, so I'm gonna talk to you about what happened in week 15. So week 15 was generally a good week. Morning sickness is starting to get more manageable. I'm still feeling sick and I'm still being sick, but it's definitely better and more manageable than it was in the first trimester. And I am being sick about once a day and in the morning, which is quite funny because on my last video I did mention that the name morning sickness was a bit weird because to me it's like all day sickness, but I still feel sick all day, not just in the morning, but I'm kind of forcing myself to only be sick in the morning. That's like my rule. It doesn't matter how sick I feel. If I can control it, I will not be sick any other time other than first thing in the morning. And the reason for that is because I want to keep my nutrients in. I want to keep my food down as much as possible. Last time I worried so much that I wasn't giving baby the nutrients that the baby needed, and I was being sick so much throughout the day and not keeping my food down and losing so much weight. This time I'm kind of determined to keep my food down as much as possible so that I stop losing weight and start gaining weight, which is what's best for the baby. I think what's helped me is definitely keeping eating, and that's harder than it seems, harder than it sounds, because the last thing I want most of the time is to eat. But if I can stomach anything, I will make sure that I keep eating regularly so that I don't feel as sick and as horrible as I feel when my stomach is empty. And when nothing helps, I literally just have to breathe through it and power through it and kind of like take myself out of the situation if I can. So if I have someone that can look after James for 5 minutes, I'll just go and have a lie down, or I'll go and do something to take my mind off the sickness, because I really don't want to like my weight to start dropping again. I've only just started gaining weight now, which is good. I think I've gained about half a kilogram or a kilogram, and yeah, I'd lost about 4 kilograms from when I found out until recently, and now I'm starting to gain the weight back, which is good for baby. And in any other circumstances I'd be like, oh my god, I don't want to gain weight, but in these circumstances of course I want to gain weight because it's for the baby. So yeah, morning sickness is definitely getting more manageable. I still don't feel like myself and I still don't feel normal for sure, but I feel better and I feel like it's on the mend. And at this point now, 16 weeks, I feel how I felt at about 25 weeks with James, which is a big improvement because it's almost like 10 weeks of feeling 10 times worse than this. I'm kind of glad that this time round I've done everything I can to make sure that my morning sickness doesn't take over my life like it did last time. Now for another symptom, I have been salivating so much, and this has been going on since the first trimester and it hasn't stopped still. And it's the most infuriating and annoying thing in the world because I just salivate all the time. Does anyone else feel like this? There's just so much saliva at the moment, and yeah, swallowing it makes me feel even more sick, and I just try my best to keep that saliva at bay by swallowing things with it, like food and drink and chewing gum, just to get the taste to taste a little bit better. But there's just so much of it. Supposedly it's quite common, but there's just too much of it and it's so annoying. My next symptom is backache. I've started to feel a lot of pain on my lower back. It just takes me back to my previous pregnancy and it wasn't very nice, and sometimes I have to wait a second and kind of like compose myself before I get up because it's just so painful. And the problem is I know it's only going to get worse because the more weight I put on, the more pressure it's going to put on my back. And yeah, It's just one of those things, but it started quite early on this time round. So I think as well, because I'm struggling with, you know, carrying James and bending down and doing so much around the house with him, it kind of contributes to it. And last time I didn't have this extra add-on in terms of, like, you know, things that I had to do. It comes with the territory, there's nothing I can do about it, but that's one symptom that has started much early on, is backache. Another thing which is like different from last pregnancy is my hair. During my first trimester and kind of like start of the second trimester, which is where I am now, my hair was falling so much that I was getting worried that I was getting a bit worried that I was going to go bald. And this time round I've experienced no hair loss, well, apart from the usual, you know, falling of normal hairs. Nothing out of the ordinary, which is great. My hair actually feels thicker and, you know, shinier and nicer, which is great. It's a nice perk of pregnancy. In terms of skin, I haven't broken out, I haven't had any spots. I haven't felt any different in terms of my skin. Last time I had extreme dry skin followed by extreme oily skin around about this time, and this time nothing has changed on my skin or my hair. My nails are just as strong, like makes no difference at all. So that's something that is different from last pregnancy. So I think that's it for symptoms. In terms of cravings, I've been craving ice like a mad woman. I don't know if I mentioned this here before on my channel, but I know I've mentioned it on my Instagram. And if you're not following me on Instagram, please go check out my Instagram. I'll leave my profile link below so you can follow me. But yeah, craving ice, and it's quite weird. My husband hates it. He says it's very noisy. It's very just unpleasant to be around me when I'm like just crunching ice with my teeth, and I just find it so satisfying. I've read online that it's quite a common pregnancy craving, even though it's a crazy one. But I've also read a couple of things that are slightly worrying. One of them is that ice cravings could be linked to iron deficiency, and the other one is that it could be linked to gestational diabetes. It's probably nothing, but in worst case scenario it could be one of those two things. And I do think I have low iron levels just generally throughout my life. I've always had low iron, and in my last pregnancy I also had low iron, so it could be due to that. But it could also be the gestational diabetes. So I'm going to talk to my midwife and ask her to see what she thinks. Maybe it could be worth doing blood tests just to rule it out. And maybe if she hasn't kind of like booked those blood tests because I don't have any other risk factors, it might be worth looking into it, just because if it does develop into gestational diabetes, I don't want to be thinking that I could have avoided it or caught it earlier on. And yeah, I'm just like, you know, trying to be more cautious than anything, and I'm going to speak to her and see what she says about that. A couple of nice things have happened over the last few weeks. The first is that I've been able to hear baby's heartbeat much regularly now, and I don't know if I mentioned here because I can't remember what I've mentioned on my channel and what I've mentioned on my Instagram, but I bought a home fetal Doppler, and I got mine from Amazon. I'll leave the links to the one that I got below. And when I got it, I was just over 12 weeks pregnant, and I did read all the kind of like instructions and the warnings about if you can't hear baby's heartbeat at first, don't worry. It could be just that baby is too small and it's difficult for you to find it yourself. You've got to know what you're looking for. There's all of these other noises that the Doppler will pick up, such as my own heartbeat and other noises from inside your body. So I did buy it anyway because I thought it's worth a try. It wasn't too expensive. And the first time I tried, I couldn't find baby's heartbeat at all. So I didn't get worried. I was prepared for that. But on the back of my head, I was just like, damn it, I hoped that it would be one of those things that people say it for the sake of it, but it doesn't really happen, that you know, you can always find it. So I left it. Next day I tried again for about 20 minutes, really calm, like lying down on a bed, and I found baby's heartbeat, and it was amazing. I could immediately tell what the different sounds were. When I heard the heartbeat, there was no denying. It was so fast. It was about 170 beats per minute. And I know a lot of people have like theories, or like, oh, the heartbeat, if it's fast, it's a boy, if it's slowest girl or the other way around. I don't really know, but I haven't looked much into it. I'm not really into all that kind of like old wives' tales kind of thing. So it took me a while to find it, but I found it. But now I'm able to find it quicker just because I know where to look for. I know kind of roughly where baby is on my lower stomach area. So I've been able to find it much quicker, and it's just really reassuring. I don't do it every day. It's only every, like maybe once a week or twice a week if I'm feeling like I want to, you know, a bit of reassurance. It's just something nice to have, and to me it's been worth the money. A lot of people don't like it if they can't find it. They don't think it's worth kind of the stress. If you are someone who's usually stressed when you know, like might feel anxious if you can't find it, maybe don't buy it. But if you just want a little bit of peace of mind every so often, or you know, just want to try and see what you can find, yeah, I think it's worth it. It's definitely been worth it for me. And the other lovely thing that happened, I'd say from mid 14 weeks to the start of 15 weeks, was that I was able to feel the first kick, and it was just such a very gentle flutter, and followed by one or two like little touches, like gentle pokes. But it was amazing. It was just like I knew exactly what it was, because I remembered from my last pregnancy what I was looking for. On my last pregnancy, I felt the first kick at 21 weeks. This time it was much earlier, 14 to 15 weeks. But like I said, I knew what I was looking for. I knew the difference in the kind of like feels when it's gas, when it's other things, and when it was a kick. So it's definitely a kick, and I've been able to feel it much more now. They're still not strong, they're still very gentle, and my husband hasn't been able to feel them yet, which he's a bit gutted about, but I'm sure he'll be feeling it soon. But I do feel it quite often, just like very gentle, every so often a kick here and a kick there. Baby is still quite small, but definitely nice to feel the kicks. It's one of my favorite parts of pregnancy. And like I mentioned a few times before, pregnancy is not an easy time of my life. I don't usually feel my best. I don't usually look my best. I don't feel depressed or anything like that. It's just that I feel like I have all the annoying symptoms, and I have a hard time with them. And I feel like that kind of gets me down a bit, because I feel like I should be enjoying it more, but then I don't feel great. Anyway, so yeah. Kicks definitely kind of like make up for any morning sickness, anything that I've ever experienced that gets me down during pregnancy. Those little kicks are worth it, and they're amazing. So I'm so glad I've started feeling them now, because it just puts my mind at ease. When you feel the kicks, you know that baby is fine. Well, but for most part, you know that baby is moving, and that's usually a good sign. So that's been amazing. I have received my letter back with the Down syndrome results from my 12-week scan and my blood results, and everything is perfect, fine. It came back as low risk, which is exactly what we wanted to hear. So that's amazing and great news. We were really happy about that. I've also received a couple of letters for appointments. If you missed my previous updates, on my last pregnancy, I developed pre-eclampsia towards the end of my pregnancy, and I had to give birth at 37 weeks because baby wasn't growing as expected, and my blood pressure was really high. There was protein in my urine, and the doctors just thought it was best to induce me than to carry on, even though, you know, I wasn't in any danger. Apparently, when you develop pre-eclampsia or signs of pre-eclampsia, if you're full term, there's no reason not to deliver baby, because baby is already fully formed. So that's what happened in my last pregnancy, which means that I went into this pregnancy as a high-risk patient. And all that means is that my care is no longer midwife-led, it is consultant-led. And that just means that I get appointments with an obstetrician and with the midwife as well. Some people don't like it, some people don't want to be labelled as high risk because they feel like, you know, I don't know how people feel about it, but to me, it's not a problem at all. I don't care that I'm high risk. I just want everything to be okay. And if anything, the extra appointments, the extra scans just give me more peace of mind. And I just I don't really care at all that I have to go to hospital more. The one thing is that if you're high risk, you don't have certain options when it comes to your labor and your delivery. You can't have a home birth, you can't have a birthing pool, you have to be attached to a monitor to monitor baby's heartbeat and your heartbeat and things like that. But because that was my experience on my last pregnancy, when I gave birth, I had all of that. I had the monitors. I didn't find it a problem. Like I said, I prefer to have the reassurance, and it was really reassuring to have those monitors, even though I just, they weren't very comfortable. It's not the most comfortable time of any woman's life anyway, and I was just glad to have the monitors, to know what was going on, to know when baby's heartbeat was good, when it wasn't good, when mine was good, when it wasn't good. So it was a bit of a no-brainer to me. The midwife did ask if I wanted to be labelled high risk or if I wanted to carry on being just midwife-led, but I just went with what I thought was safest. And to me, the safest bet was to go consultant-led, because I do not want to be in the same situation that I was last time and being caught by surprise with a diagnosis of pre-eclampsia. So that's what's been different with my care this time around. After having pre-eclampsia, I've basically been offered more appointments with a consultant and also probably more scans towards the end of the pregnancy. So far, I haven't had any consultant appointments. I only had my midwife appointment at 10 weeks. Then I had, well, that's on the NHS. So if you're in the UK, this is what you get with the NHS. So it's an appointment at 10 weeks so far with the midwife, which is called your booking appointment. Then I had my scan at 12 weeks. And then I have an appointment with the midwife at 16 weeks, which only just happened a couple of days ago. And that was only to do my blood pressure and my urine. Then at 18 weeks, I have an appointment with the consultant at the hospital. So I'm not 18 weeks yet, so I don't know what that appointment will be like, but I'll let you know on my pregnancy updates what that's like. Then at 20 weeks, I have another scan, which is the kind of the anomaly scan and the one that you can find out the sex of your baby. But I also have a scan booked in for next week to find out the sex of the baby privately, because I just don't want to wait all the way up to 20 weeks. I did exactly the same with James. We had such a great experience with him. We're going to exactly the same place, which is Babybond Ultrasound Direct in Cardiff. And yeah, so I'm really excited. That's happening next weekend. So I'm filming this on a Friday. So by next Saturday, I will be able to tell you whether or not we're having a little boy or a little girl. I still think I'm having a boy. I'll be really surprised if I'm having a girl, because I don't know, just I feel like I'm having a boy. I can't explain. But yeah, so we'll be finding out next week. And let me know what you think, if you think I'm having a boy or a girl, based on my pictures that you've seen on Instagram, on the way that my bump looks, or just like your knowledge and your expertise of knowing these things. So yeah, so that's what's happening then. And then after 20 weeks, I don't know what's happening, but when I know more, I'll update you more, because I think this is interesting to people who have had pre-eclampsia before and are now pregnant or thinking of getting pregnant, but don't know how that's gonna, be different, how it's gonna affect them. And I definitely was a bit unsure as to, what's gonna happen this time. Why am I being labeled high risk, and what's the implication of that? And to me, it's worth it, in the sense that I'd rather everything goes smoothly because it's being monitored and it's being detected early, than being kind of like rushed into anything like an emergency C-section or an early delivery, because I wasn't being monitored like closely enough. So I prefer to be on the safe side of things. So I think that's all my updates. I do apologize if this video looks a bit weird or different. I just got a new camera, and I didn't mean to use this camera as my main YouTube camera. I only bought it because it was smaller and more portable. I'll leave the details of the camera I got below. It's called Sony a6300, and I'm really excited about this camera because it's much smaller than my big DSLR camera. I can fit it in my changing bag, and I don't have to miss any more moments with my son that I've been missing so much, because I was missing like a good camera that was portable. So I bought this camera and I thought I'd try it today, but I haven't really played with it. I don't really know what I'm doing yet. I've only just got it like a day or so ago, and I haven't had time to play with it properly yet. So do apologize if things are not as they used to be. When I edit this video, I'll be able to know whether or not I like the results or not, and you will tell me if you like the results or not anyway. So I went off on a tangent there. I didn't mean to talk about cameras on this pregnancy update video. But anyway, if you have any questions or if you have anything that you would like to tell me or ask me, please leave a comment below. I always try my best to reply to comments or try and contact me on social media. I'm mostly active on Instagram and Snapchat these days. If you're due around about the same date as me, please let me know in the comments below. I'd love to have some bump buddies. I am due at the end of February, beginning of March. I don't know exactly when yet because I technically I'm due beginning of March, but I know that with my history of preeclampsia, I could be having this baby in the end of February if I'm kind of like having to deliver early. So I'm saying to myself, February, March could be any time between Feb and March. So if you're due around about that date, then let me know in the comments below. It'd be really interesting. If you do vlogs as well and you're vlogging your pregnancy, I would love to watch them. I love watching pregnancy updates and things like that. Or if you have a blog and you do the updates on your blog, please leave your blog link below as well, and I will be sure to go and check it out. If you like my videos, don't forget to subscribe to my channel. It's the best way to keep up to date with new videos because you get a notification every time I post a new video, so you don't miss any of my videos. And if you liked watching this video in particular, give it a little thumbs up. The button is just below the video, and yeah, that just lets me know that you guys are enjoying my videos and that you want to see more from me. And here is my bump for 15 weeks. I think I definitely popped much earlier in this pregnancy than in my last pregnancy, but I do love having a bump. Just makes it all so real and lovely. So yeah, this is my little bump. I hope you're having a lovely day, and I'll see you very soon. Bye.